Dear viewers, welcome to today's format, Visite. At this point, thank you very much for your letters and notes. Today I would also like to pick out one or two letters. The first one comes from a young family whose little Joshua was born in 2011. The child has Down syndrome. Thank you very much for the incredible research of your health practitioner, who has put together an incredibly great orthomolecular recipe, as well as a very good explanation of the many micronutrients, especially in the area of children with Down syndrome. Thank you very much. You also describe that the little one, already 3 years after his birth, developed an acute lymphatic leukemia. Of course, they had to act within the framework of this leukemia. This is a disease that otherwise leads to death very quickly. You describe today, in 2022, that the boy is suffering from very strong energy deficiencies. His lung capacity is very low. He has limited microcirculation. You have written that you are now using a Kleintje mat. As I said, his lung vital functions are very low. That was your big question: in what context? What else can you recommend to us? I have taken from the documents that you are incredibly committed to this little Joshua. And of course, you are always looking for new advice and ways. I would like to pick something out of this letter. You describe that during immunosuppression, which means an enormous attack on the immune system under chemotherapy, and that was a time span of well over a year, for the boy a chronic mold fungal strain with necrosis in the frame of the nose, palate. You can also see it in the picture. Thank you very much. You sent it to me where one can see how it destroyed the front of the upper jaw. The all is treated therapeutically by a so-called prephase therapy. Then these leukemia cells are destroyed. This phase is initiated quite gently. But a second de-induction phase binds to this phase. This means that the leukemia cells, including the others that still need to be reproduced, have to be strongly repressed, so that the new, healthy blood formation can re-establish itself. As part of the consolidation phase, the remaining malignant ones are killed off. This means that the doses also change. Here they become less and less. Of course, you don't want a relapse. You don't want these remaining leukemia cells to get the upper hand again, until you do a so-called retention chemotherapy afterwards. If not a stem cell therapy. But I didn't see that in the notes, that he did stem cell therapy. He was treated for a long, long time. In order to say today, within the framework of this all. And it's been 8 years now, that the child is no longer burdened by an all. But of course also has its long-term damage from it. And that was actually the point I wanted to tell you. Of course, an aspergillosis is a fungus disease. And a fungus disease always needs the corresponding body milieu. I'm going back to Professor Enderlane, about this so-called pleomorphism. We're talking about the multifaceted nature of microorganisms. Not only did he discover, but he actually observed what had been observed many years before. He himself was a bacteriologist at the Zoological Garden in Berlin, lived there until 1916. And Ender Lane documented hundreds of scientific evidence, materials, and publications, in which he actually defined this multifaceted nature of microorganisms. The company Sanem, Kelbeck, is a company based on this knowledge of pleomorphism, also on the basis of Ender Lane. And Kelbeck then had the father, who is already the fourth generation today, develop a so-called milieu therapy. That means I can never have a permanent aspergillosis. If I don't give the milieu of the body, this aspergillosis, the incentive, it is not possible that you have an intertriginous fungus disease. If you don't change the milieu in such a way that this fungus turns from its own microorganisms, which live on the skin, into a fungus. In other words, Candida. That means you have the red, it burns. But that was only possible because it was moist and because it was warm. If it is no longer moist and warm, if you are a little overweight here again and again under the armpits or in the crotch, and then the folds are actually more and more put together, there is no air at all and it sweats, then billions of microorganisms on the skin develop in the highest form via the stage of the bacteria, then the fungus. And this so-called pleomorphism of Ender Lane and the therapy that develops from it is an idiopathic therapy in the sense of always optimizing a milieu. And that's actually a bit of the point that I wanted to put at your heart. You would certainly have already done microscopic dark field examinations. But one is the examination and the other is the milieu correction for the little one. Because, of course, with an aspergillosis that was already defined and, of course, the consequence of the aspergillosis, this necrosis. An aspergillosis also affects the mucous membranes, i.e., bronchial mucous membranes and lungs, and may still be responsible for an aspect today that owes this little one this lower vital capacity again and again. The aspergillosis can actually be diagnosed. There are laboratories such as IMD, but also other laboratories such as BioVis, and they do a LTT on mold fungi. This is a lymphocyte transformation test that tells us how far the immune system is required to deal with an aspergillosis, but not only aspergillosis, but also Penicillium notatum. Or, for example, Candida or Mucormyceto. This is a block that contains about 10 different mold fungi. And you don't approach it therapeutically by saying against, but someone who is a trained Sanem therapist, who knows about this pleomorphism of Ender Lane, who knows about the diversity, who knows that in the context of an aspergillosis problem, which environment does the aspergillosis need so that it always develops to an aspergillosis level higher, who knows what Penicillium notatum needs so that it always develops to a streptococcus. For example, the penicillium notatum cyclode, as it is called, develops in all itis diseases. Tonsillitis, mold inflammation, otitis, ear inflammation, bronchitis. And maybe you will come to a problem that is a bit more complex than what I'm saying now. But you can get on quite well here through good environmental therapy. The company Kelbeck Sanem can certainly name a very, very experienced therapist to then maybe also go into a specific environmental therapy. For me, Sanem therapy is a therapy that starts at the deepest point of life. If you understand that the body is equipped with billions of microorganisms, that these microorganisms, of course, take on incredible tasks for us in the production of B vitamins, in all the digestion in the gastrointestinal tract, in the preparation of B12 via coli bacteria. But these microorganisms that inhabit the skin, that inhabit the mucous membranes, they can change. They can go into a higher form. And the higher form is then answered by the body with an inflammation, because it is a pathology. Then, for example, penicillin notatum develops an inflammation that the body tries to remove via this environmental correction. And an isopathically trained doctor knows what means he can use to get back into balance in the young person, long-term, from the experience that he had a severe aspergillosis at the time, now in the context of a very broad and well-established environmental therapy. Of course, these are also attacks on the actual cellular energy system. All ampoules of the citric acid cycle A from the company heal. You can also give these ampoules to children. The children can drink them after a cycle, twice a week. 10 ampoules. Of course, you have to dose differently for the little one. This is administered according to a certain scheme. You don't have to inject it at all. All heal ampoules are approved for oral use. Of course, you also have to, and I don't want to repeat myself, because I don't know what you've already done, but please always think of the mitochondrial function of the mitochondria, of the energy change on the cellular level, which, of course, is also severely damaged by any antibiotic. Because mitochondria, the energy plants, are also a microorganism. It is also important to analyze whether this mitochondrial metabolism is still in balance. What about L-carnitine? What about energy ATP production? What about Q10, ubiquinone? There is also a wonderful liquid form from the company MSE, Dr. Ensman. So, for these things, you may also have the possibility to take a step back. I couldn't quite see from the documents whether they were already doing this. But back to the company Sanem and environmental correction. These are, of course, a lot of things that also have immune modulating abilities, e.g. through Mycobacterium bovis, or e.g. through Citrokel. These are drops that activate the cell energy metabolism by improving cell respiration. Or, e.g., through nigazane drops, which are taken 3 times a week. This is already the information of Aspergillus niger. But homeopathy always works the same way, with the same thing, to call out a state of the redevelopment of these microbes. Mucocell, always for the improvement of microcirculation. Because life always decides on the cellular level. And, of course, never forget the dextrorotatory lactic acid. In Germany, this is called Synuvis. In Switzerland, this is called Lactavis. This means that you give the dextrorotatory lactic acid 2 to 3 times a day. This is the organic acid to the mucocell, to the mucoracemosis, which is essentially responsible for the flow of erythrocytes, the cell membrane activity of the red blood cells as oxygen carriers. And you spoke of your energetic testing here. Wonderful that you also detect a microcirculation disorder. I believe that these 1, 2, 3 drops for the little one 3 times a day, in combination with Synuvis, should accompany the little one in the future in a large, patient form, perhaps not every day, but 3 times a week. And especially the mold problem, I would like to ask you again to intervene with an LTT. Yes, I think the time is a bit short for a second case. On the other hand, I think we still have 5 minutes. And I might want to use that. So thank you very much for writing this. This is a patient I got to know and came with the question of breast cancer. And she is facing the decision of an estrogen blockade by tamoxifen and an aromatase inhibitor that blocks the estrogen receptor. As part of her estrogen-positive tumor, she decided to have an operation. That was also very valuable and very right. But then she decided against chemotherapy. And came because she wanted to know, that is my deep gut feeling, that I should actually start now, maybe to take care of myself. What did that lead to? That my body developed a breast tumor? Where do I have to start? What tasks are in front of me? And I would like to take that into my own hands. The patient's date of birth is 1957. She was diagnosed and came 6 weeks later for a 1-week stay to discuss everything that was in front of her as part of a first full-body hypothermia in order to have a natural chemotherapy. You should have a protective effect. Tumor cells are normally heat-resistant. Fever creates an incredible thrust on an immunological tumor defense. And she did all that. And I just wanted to give you an explanation why we are currently facing a direct tamoxifen therapy according to guidelines, which perhaps should not be formulated quite so quickly. The patient had a so-called neurobalance profile. All tumor patients are examined for an adrenergic stress profile. That means that between a weakness of the adrenal function, behind which is often a life that was associated with a lot of stress conflict, the body gets into an adrenergic stress and has to produce an incredible amount of stress hormones. And I looked at this stress profile. And there was a clear loss of DHEA. DHEA is dihydroanisotherone and it always sacrifices the adrenal glands first. That means that both the morning value and the value after 8 hours were significantly below the norm. DHEA is responsible for many functions in the body, for the general well-being, for the immune performance. DHEA becomes estrogen, becomes testosterone. DHEA is not only a pre-hormone for other sexual hormones, but also the opponent of cortisol. It regulates the body weight, it regulates and strengthens the fat depletion, and has a role in many metabolic situations. That means that a very fast receptor blockade is one thing, but the addition of estrogen is actually not visible here in the foreground. But the body is actually slowly getting into an estrogen deficit. The other thing is, and we have already made several broadcasts, this patient has a genotype in the context of the catecholaminyl transferase, and I have already explained this several times. The CUMT is actually the enzyme that breaks down estrogen. And if estrogen is not broken down, it naturally accumulates and, of course, an excess of estrogen can also activate a tumor cascade locally. That means it was still visible here, but in the long run there is actually a deficit, although the hormone profile has balanced out to some extent. We also measured that in the saliva. But this value explains why it is an estrogen-positive tumor. And now, of course, the question arises with a 50% reduced activity of this enzyme and a 50% optimal work. Of course, we now have to go in to build up this enzyme activity. This is done with B3, with B vitamins. This is done with magnesium and with SRM, the S-adenyl methionine. And we will look at this in the long run to see how far estrogen can be better broken down with it. And there was another important finding. The patient is actually also a bit overwhelmed with estrogen, because it has an increased value of bisphenol A. Bisphenol A acts as a xenohormone. The channel TV QS24 also has a wonderful show about the use and usefulness of hormones. But these xenohormones are incredibly important. Also, as we know today, in the development of estrogen-positive tumors. And not just mamma Ca, but also prostata and colon Ca. The standard value is below 2, and the patient has 7.3 micrograms per liter. So away from everything that is plastic, coffee machine, everything that comes in contact with liquids. There are now hundreds of studies that also offer good receptor protection through the triindole carbonyl, a broccoli extract. But I just wanted to briefly introduce this case, which should think very critically about what is behind a receptor blockade and what things are to be done. Because tumors and estrogen are of course one thing, but please don't underestimate that there is a body behind it that is essentially also dependent on estrogen. And it is much, much more than you think with a receptor blockade. Especially since there is also a certain risk in medication alone. But I don't want to expand on that today. I just wanted to sensitize you that you might go very far in terms of a tumor disease. To understand why this disease has arisen in me and where I am now also required to do something. And the patient does this in an incredibly, really big, responsible way, facing himself. In this sense, I would now like to switch gears and ask the director to give a little closing thought about the spring of 2022. You should be closer to life than usual. In the break with yourself and the world. Losing yourself more at the moment. Feel the spring. Linger in it and breathe it in deeply. We should dissolve distances between us. Become deeper and deeper in love and stronger in trust. And then do the right thing. In this sense, thank you very much. I wish you all a wonderful week ahead of you. See you out there. A moment full of flowers and splendor. Enjoy the moment. See you next time. Thank you.